Hello, this is Joe Yuhan here to talk about stride-specific stressors that cause Achilles pain. Conventional wisdom in the sports medicine community says that Achilles tendon pain is an overuse issue. It's either running too much, running too fast, or maybe running too many hills. I just don't believe that, especially when Achilles pain, Achilles stiffness, or just chronic issues at the Achilles afflicts so many runners that otherwise run consistently. So how can that be? For me, it's because there are stride inefficiency components that lead to stressing out the Achilles. And we're going to talk about three primary inefficiencies. The first one is the most significant common inefficiency for all running injuries, and that is overstriding. And so overstriding is any time any part of the foot lands in front of the body. So in the efficient state, we want to have a hip-hinged, forward-oriented body position so that when we land, that foot lands pretty close to underneath our body. It's not perfectly beneath, but it's slightly in front, almost directly underneath the trunk. Pain happens when the leg either overreaches, or there is a posture deficit, or the combination of the two that results in our body being back here and that foot being in front. Specific to the Achilles, it is almost always landing on the forefoot. So the forefoot landing really engages the calf to take that excessive load. So whether there is a posture deficit or not, if we're here or here and we're landing on a forefoot, it's the calf, Achilles, and foot complex that has to absorb that excessive energy. There's a huge and probably the primary driver in Achilles tendon overload amongst runners. So our strategy, which we'll talk about in the next video, is about how to get that foot underneath us. The second one is much less talked about, but possibly just as common, and that has to do with foot strike. So in the efficient state, there is a small but significant amount of supination to pronation that happens when we land on the outside of the foot, rolling in as we push off. What happens with some runners is that the magnitude of that supination is increased so that they're really landing significantly on the outside of the foot and really creating an excessive pronation moment. And how that affects the Achilles is you have this band of tissue that runs ideally, efficiently in a straight line. But what happens if we land excessively on the outside of the foot is two things. Number one, as you might be able to see, you get an excessive lateral stress on that band of Achilles tissue when you initially land, and then the Achilles actually has to overwork or gets overstressed in the pronation as well. So when you land, you invariably will slap down, and so now the medial aspect of that Achilles gets stressed as well. And so that excessive frontal plane stress can stress the Achilles on both the medial and the lateral aspects, which it's not designed to do. It's designed to take load primarily in this plane and not have to deal with excessive lateral to medial stresses. So that's a huge and really overlooked stressor of the Achilles that we can optimize based on how we land with our foot. The last one is probably the least recognized of all of the Achilles stressors, and I call this deflating. And so what does that mean? When we land, in addition to landing underneath the body, what needs to happen is the lower leg as a whole, both the ankle and the knee, needs to stay pretty straight as we pass over it. So I like to think about pole vaulting. You've got this pole, you plant it in the ground, that pole needs to stay strong to pass over it efficiently. So what deflating is if we land and instead of staying strong at the ankle and the knee, we bend. And you can see this excessive bending is sort of like a deflated position. And so while efficient running should look like landing underneath us with a mostly straight leg, this is what deflating looks like. You'll have a runner usually deficient in hip hinge, but they get this bounce, or at least just they're sunk down. And so they're running like this. And because my knees are past my toes, that puts with every stride excessive stretch stress in the Achilles as well as the foot and the calf. Additionally, this is also a knee stressor because the knee gets excessive load and excessive stress too. So that is a tremendous stressor of overstretching of the calf-Achilles complex with every landing. So those are the 3 stride-specific stressors of the Achilles. In part 2, we'll talk about stride-specific strategies to optimize those.